Hey everybody, Dr. Kaylee here, owner and founder of Femme Empowerment and Advocacy, also creator of the Leap No More series online and the Femme Empower swag store. And I just wanted to come on and answer a couple questions that I've been getting about exercising during pregnancy. And I've done videos on here before, and I've talked about the fact that it's really important that you actually exercise during pregnancy because it's very good for you. But I also wanted to touch on reasons not to exercise during pregnancy. What are some things or reasons why you may not be able to? Because a lot of times your doctor might tell you you have this condition, you can't exercise during pregnancy, or you're having signs and symptoms and things, and that can help or cause a limitation of exercising during pregnancy. And first and foremost, I wanted to talk about what does a contraindication mean. A contraindication is something that you really don't want to do if you can help it. So what we do in the medical world is we actually separate that into two, especially in the exercise physiology world. We separate into that an absolute contraindication, which means absolutely not, there's no way around it, you should not exercise during pregnancy. And then we do a relative contraindication, which is where you can with modifications, but you got to be super, super cautious about the exercise choice. And you really need to be working with all of the medical professionals involved in your plan of care in order to actually do this appropriately without causing harm. So I wanted to name off a couple of the things that are considered an absolute contraindication, or reasons that you absolutely do not at all want to exercise. One of which is a significant heart disease, uncontrolled or not treated hypertension, which is high blood pressure. If you have lung disease, cervical insufficiency, which is blood flow getting to the cervical area, and risk of premature labor, whether that is in previous pregnancies, meaning you've had several preemies before, or now you have been told that you are at risk for premature labor. A placenta previa after 26 weeks of gestation, preeclampsia risk, or anemia. Anemia is where you have a deficiency in iron. All of those are listed in the American College of Orthopedic Sciences, and all of those things, all of those are listed as ACOG. I think I said that wrong, actually. It's not Orthopedic Sciences. I'll have to look that back up and I'll put it down. Right now, I can't remember what ACOG stands for. But absolute contraindications of exercise are those that I just listed. Those are things that your doctor, your OBGYN, your gynecologist, your medical professional that is delivering your baby, they are going to diagnose you with and tell you, hey, you have this. If you have that, that's something that you want to take to your physical therapist and say, hey, I have this disease. Am I able to exercise? They said no. And that is where the physical therapist is trained to understand the difference between an absolute and a relative contraindication. And if your medical doctor said no, typically we're going to agree with that too, especially if you're an athlete and you have a risk of causing harm to your baby. If you exercise and you have an absolute contraindication, you are actually going to risk more or further damage to yourself or your baby, and that's just not something that you want to do. So the next one is the relative contraindications. These are the things that you want to be really cautious of. You want to work with a physical therapist closely, a pelvic floor specifically, because remember, we're the ones that are trained with exercise during pregnancy and understanding the changes that your body goes through and understanding how to continue to prescribe exercise without causing dysfunction in the pelvic floor or causing irritation. So some relative contraindications are a history of premature birth or a miscarriage history. So those are things that you want to consider going back into exercise. Enlargement of the cervical region, poorly controlled type 1 diabetes, extreme underweight, orthopedic impairments. This can be anything like back pain, knee pain, hip pain, things like that. Poorly controlled seizures, and relative contraindications, I would actually myself add in pelvic floor dysfunction. A lot of things like prolapse or a lot of urinary incontinence, fecal incontinence, chronic constipation, things like that you can technically make worse if you don't do it the right way. But again, relative contraindications means that you can actually go into exercise and doing things, but I recommend that you do that with a healthcare professional by your side. Pelvic floor PT recommended. But let's say you are not told that you have any contraindications and you're pregnant and you want to exercise. What are some of the things that you need to look out for that says, hey, I need to stop exercising now? Because I get asked a lot, when do I stop doing burpees? When do I stop doing handstands? When do I need to stop doing all of these things? And so I'm going to go over some of the signs and symptoms of that. One of which is vaginal bleeding, which I know to you, you're probably like, oh, that's common sense. I already know that. Well, if you're bleeding vaginally with exercise, you want to make sure that you eliminate that exercise or modify it immediately. regular or painful contractions. So you're going to feel like you're going into labor, but you're not in time for labor. That's another reason why you want to modify or eliminate the exercise. If you have fluid leakage, amniotic fluid specifically, and that's something that you would ask your OB or your gynecologist or your midwife to ask what kind of leakage or discharge you're actually having that's coming out of the vaginal canal. And if it turns out to be amniotic fluid, that's going to be an issue because you want to make sure that your baby's protected, and the amniotic fluid is helping to protect the baby. Any difficulty exercising prior to exercise or difficulty breathing during exercise is going to be a really, really big one. So you want to make sure you're working within an exertion that you're able to tolerate and that you're not going overboard, so that you're not huffing and puffing and being able, because if you do that, you're not getting oxygen to yourself or your baby, which is going to cause dizziness and lightheadedness and all kinds of issues. Headaches, chest pain, muscle weakness, and calf swelling or tenderness, any risk of DVT. DVT is a blood clot, so if you have any severe pain in the calf region, or you're having a lot of tenderness in the calf region, or a lot of swelling in the calf region, things like that, those are going to be things that you want to consider eliminating exercise with. And I always recommend that you actually tell your medical professional or somebody that you're working with, hey, these are the symptoms that I'm having, and I'm not really sure if I should continue to exercise. So those are all the things or all the reasons why you wouldn't be exercising during pregnancy. And again, based on my experience and expertise, this is not any medical advice. It's not to be taken that way. But please understand that these are things to talk to your doctor about, and always have a pelvic floor physical therapist on your team, because we're the exercise science specialists. We know how to prescribe exercise. We know how to prevent pelvic floor dysfunction. We know how to help you through these types of things. So even if you are pelvic rest or bed rest, and that's a topic for another day, but even if you are said, hey, told, hey, you can't exercise, you shouldn't be exercising, a lot of times the pelvic floor physical therapist, we have a lot of things that we can recommend you do, whether it is just flexibility in bed, labor positioning, massage techniques for your spouse or your partner. There's a lot of things that we can do and change up to help you through that. So I hope that helps. If you have any questions, you know how to contact me. Shoot me a direct message or comment below, and I would love to answer those.